Welcome to the Worcester Senior Center Distinguished Speaker Series. Today we welcome back Mass College of Pharmacy, Harvard University, and Better Oral Health Massachusetts Coalition. Today, BOMAC will talk about oral health education. They are presenting on oral health, and this year's topics include procedures, concerns, dentures, and prosthetic care. Your questions are very important. This entire event is courtesy of BOMAC. Lunch entertainment will be by Ash and Eric, an acoustic folk duo. So take it away, BOMAC.
Yes, thank you. I just want to say thank you for having us. We're so appreciative. It's beautiful the way Suki and the staff set it all up. So thank you so much for allowing us to come and talk about oral health. And I'm so excited that we have our members here today with us. BOMAC is a state organization that advocates for good oral health for all residents of Massachusetts. So we're delighted to be here. And I'm delighted that Dr. Gunder is here. Dr. Gunder is an international dentist from India. And Dr. Lisa Thompson, who is a dentist from Harvard. Did I say that like a Bostonian? And then over here we have Marcy Foreman. Marcy is a dental hygienist in the area. She's a public health dental hygienist. So thank you, everyone. And we're going to start off with Dr. Gunder.
So good morning, everyone. I'm Dr. Sneha from India. I'm a general dentist back in India, and I recently... Okay. Can you hear me now? Okay. So I recently graduated with Masters in Public Health from MCPHS University, and I'm a general dentist from India. So I'm here, so grateful for giving me this opportunity, especially Dr. Laspina. So let's just start. We'll discuss the connection between your mouth, your oral health, and your overall common health. That arise with your age, and most importantly, what you can do to maintain your smile every day. I'll also share some information on where you can get your dental care, and right here in Worcester, whether or not you have an insurance. So this will be an easygoing and friendly session. Please feel free to ask questions at the end, or even share your own experiences with your dental care and overall health care. So let's get started. So here's what we'll cover today. Why oral health is essential for your whole body, common oral diseases, what to look out for as older adults, and how to prevent these oral health issues. So we'll also talk about insurance coverage, and we'll also share some helpful local resources where you can receive affordable dental care. So why oral health matters? So your oral health is more important than you realize. Today you learn how the health of your mouth, teeth, and gums can affect your overall health. You might not realize it, but your mouth is the gateway for your whole body. So problems in the mouth can lead or worsen conditions in the heart, lungs, or even your brain. So taking care of your mouth is really important, as important as you take care of your entire health. So what is the link between oral health and overall health? Like any area of the mouth is full of germs. These germs are mostly harmless, but the mouth is the entry to the digestive tract and respiratory tract as well. So sometimes these germs in the mouth can lead to a disease throughout the body. So good oral hygiene includes daily brushing and flossing. So without these basic good oral hygiene, germs and bacteria thrive and grow wherever they want. Also, it's linked to Alzheimer's and diabetes. These are not just dental problems, but they are full body health risks. So we'll see what conditions can be linked to oral health. Endocarditis, which is infection in heart chambers or valves. So the germs from your mouth or the other areas of the body can spread and attack the areas of your heart. So that is endocarditis. And cardiovascular diseases, which is heart disease. Studies suggest that clogged arteries, which is arteries in your heart, and strokes might be linked to inflammation and infections from the mouth and from the germs in your mouth. So, and other condition which is more important is osteoporosis, which leads to bone loss, including your jawbone. So the can also make your dentures unstable or loose. This is one of the indication you'll know if you have this is a basic diagnosis trick for osteoporosis. And inform your dentist if you're on bisphosphonates or other bone medications. And pregnancy and birth complications. So gum diseases called periodontitis, which starts with inflammation of gums and can also affect your bone, has been linked to premature birth and low birth weight. And pneumonia, which you all know, germs from the mouth can easily be transferred to the lungs and cause pneumonia or other diseases. And cancer, a number of cancers are linked to gum diseases, such as mouth, GI tract, which is gastrointestinal tract, lungs, breast, prostate gland, and uterine cancer as well. And Alzheimer's disease, as disease progresses, oral hygiene declines. And HIV/AIDS, oral problems like sores and lesions in your mouth are very common in this HIV/AIDS. So these are the most common conditions which can be linked to your oral health and your general health. As you all know, diabetes, which is the most super common than the other diseases, this makes the body less able to fight infectional diabetes, can put the gums at risk. And research shows people who have gum diseases can have a harder time controlling their blood sugar levels. So gum diseases occur more common and can be more serious in people who have diabetes, especially uncontrolled diabetes. There is very less indication that they might react to the medications even. And these are the few oral diseases. One is gingivitis, which is inflammation of your gums. You will notice bleeding while you're brushing, and also notice swelling in your gums. That is gingivitis. And periodontitis, or periodontal disease, advanced gum and bone disease, which affects your gums as well as your bone. And tooth sensitivity and tooth shifting, which we're going to talk next. And tooth decay, which is cavities and caries in your mouth. And oral cancer. These are the most common oral diseases. So almost half of all the adults in the United States have some form of gum diseases. I myself sometimes have sensitivity when I drink cold and hot water. So over 47% of adults in the United States ages 30 and older have some form of periodontal disease. So about 30% of adults have moderate gum diseases. Approximately 8.5% of adults have gum diseases, which is very severe. And over 70% of older adults, that is 65 and older, have some sort of periodontal diseases. So these are the most common oral health diseases. So this is how your healthy gum looks, and that is how the inflammation, that is swelling of your gum, looks like. And that is inflammation of the gums, and as well as when your bone is affected. That is called periodontitis. So healthy tooth and gums, which is the first one, which is you'll not have any swelling of your gums and nor even your bone is affected. And the second one, where plaque and tartar, you'll see a black accumulation on your tooth, which is plaque and tartar buildup with your red and swollen gums. That is gingivitis. That is your first way to the proper gum disease, which is gingivitis. And periodontitis, you'll see red and swollen gums, a plaque and tartar buildup, and also deeper pockets and loose attachment of your gums and the tooth. So gingivitis, as I said, inflammation of the tissues around the teeth, not including the bone. And this is reversible with ultrasonic scaling and even proper maintenance of your oral hygiene. It has swollen red gums, frequent bleeding when you brush, and also bad breath and pain and sensitivity as well. And periodontitis, which is periodontal disease, inflammation of the tissues around the teeth, including the bone, swollen or puffy gums, bright red and dark red or even dark purple gums. Gums that feel tender when touched, sometimes there is no pain. This is the second phase of, after gingivitis, you'll have periodontitis. So gums that, here it bleeds easily and spitting out blood when brushing or flossing your teeth. You'll notice this very frequently. And bad breath that won't even go away. So tooth sensitivity. So what is tooth sensitivity? It is triggered by hot, cold, sweet, or even acidic foods by drinking your Coke and Pepsi every day especially. Common in older adults due to gum recession or enamel loss. So use sensitivity toothpastes, fluoride treatments, and avoid harsh brushing if you want to get rid of tooth sensitivity. And there is shifting teeth, so caused by missing teeth, gum disease, or aging. So this can affect your chewing, appearance, your smile, and also your denture fit. Solutions for this shifting teeth are bridges, partial dentures, or realignment by the dental professionals. So how to take care of your sensitive teeth? Use a toothbrush with soft bristles and apply less pressure when brushing. And use desensitizing toothpaste and drink water right after consuming acidic foods and also drinks. And try fluoride-enriched mouthwashes. Avoid acidic foods and drinks that can erode tooth enamel. These are the ways you can prevent sensitivity and even shifting of the teeth. So some common other oral diseases is root exposure, gums severely receded, most likely eventual tooth loss. These are the basic things you'll notice for any periodontal disease. Root exposure, gums severely receded, and most likely eventual tooth loss. So signs you may develop gum disease. A bad taste in your mouth that will not go away no matter what you do. And bad breath that does not go away. Bad taste and bad breath. And new sensitivity to temperature or sugar in your teeth. And painful chewing. You'll often have frequent pains during your chewing of food. Tender gums, bleeding gums, including after you brush your teeth. So tooth decay, which is the most common, which is cavities and caries. This is caused by bacteria plus sugars of the food and drinks you take, which results in acids. That's a result of tooth cavities or caries. So acid breakdowns the enamel and cause caries. So they start with white and chalky appearance around your tooth, which progress into dark brown, black sticky holes, which might not look very good. So that is a picture where you can see the formation of cavities. That is the initial formation of cavities, which is pit and fissure cavity. that might even go beyond it when you not take care of it in the initial days. These are how they look, tooth cavities. This is a white spot lesion in the first picture, and that is a pop cavity. That's how it looks when you don't take good care of it initially when it actually begins. I'll give away to Dr. Lesmina. She'll talk about oral cancer now. Thank you.
Thank you. Thank you for that nice presentation. Thank you. Okay, so let's talk about oral cancer. So mouth cancers most commonly begin in flat, thin cells called squamous cells. They line our lips and inside your mouth. Most oral cancers are called squamous cell carcinoma. Right, where they come from, right, we wish we knew, right? We wish we kind of knew. One thing is when I look in this audience, I see an older adults, which means, and myself included, in the sense I didn't have the opportunity to have the HPV vaccine. Okay, we didn't have that. That is coming forth in the sense of squamous cell carcinoma in our oropharyngeal cancer, way back in your throat, is beginning. And it's actually outnumbering cervical cancer. So when you say that's, a risk factor, we weren't able to have that HPV. So if you have grandchildren, I do recommend, please encourage them to get that HPV. Other risk factors is alcohol, smoking. So where does it come from? We want to always use our sunscreen. You'll always hear that from a dental professional. Please, wear your sunscreen too on your lips. Okay, so half of the cases are in persons older than 65. The rate is increasing, unfortunately. There are different colors. We have red, we have white lesions. They can be irregular, borders, sometimes causes pain, sometimes does not. And there's your risk factors right there. Yes, our age. I wasn't going to say that, but yes, our age. So you do want to be careful because sometimes we just don't know that there's a lesion there. So very important to see your dental professional, a dentist and a registered dental hygienist. They'll do the intraoral, the head and neck examination they'll perform. A lot of times questions that I'll get from patients is, well, I have dentures. I don't need to see a dentist or a dental hygienist. Please know, yes, you do. You need not only to make sure they're fitting, but also to make sure there's no lesions beginning underneath the tongue, on the roof of the mouth, because a lot of times you will not feel it. And then it's important to get an x-ray. It's called the Panorex. The machine, I don't know if you know the machine that goes around you. Important to get that to make sure there's no cyst or tumors beginning in your jaw, because you won't feel it until it becomes big. Maybe you'll then eventually get swelling. So when to see a doctor, when to see a dentist. You always want to make sure to make an appointment with your doctor or dentist if you have any signs or symptoms that bother you and last more than 2 weeks. A lot of times, sometimes when we are in private practice and we do see a lesion, we will say, we want you back in 2 weeks because we want to observe it. Does it go away? They'll take measurements with a probe. They'll also take a picture with it. They call it intraoral camera that goes right on the computer, and they'll be able to take an image of it. Best to find it early. So, and your dentist will likely investigate other common causes. So your medical history has a lot to do with it. You want to make sure to be very detailed when you're answering those questions with your medical history in the dental office. Many times I will get a question saying, why do I need to fill this out? They'll say, I'm only getting my teeth cleaned. Well, there's a lot of factors involved with getting and working in someone's mouth that we need to know the history behind to make adequate decisions, sound decisions. So you can do a self-examination for oral cancer, and you'll look all around, section your mouth. And what I mean by that is look at your tongue first. See if you see something white that doesn't belong there. Well, a lot of times, sure, I might accidentally bite my tongue by accident, and you might see something. Make sure it goes away in 2 weeks. Okay. Another thing is, then the floor of your mouth. You can try to take a peek the floor of your mouth. And also in your cheek area. One thing I notice too is any slight change in my mouth, it could be 1 millimeter, I can feel that. If it doesn't go away, please, contact your dental professional. This is oral screenings. When you go to see a dentist or a dental hygienist, she will perform, they call it extraoral, intraoral examination, or you'll see head and neck. Sometimes they don't say anything and they perform it. Other times you'll hear them say, I'm doing an oral cancer screening. And they'll look around. They'll palpate your nodes. All right. They'll also palpate your thyroid. Then after that, they will go inside your mouth and they'll actually look around the tissues. You should see them pull up your upper lip, pull down your lower lip, and actually look in your cheek area. We almost subdivide the mouth when we're doing an intraoral examination. We'll look at someone's tongue, make sure we pull the tongue out, and look on the sides, especially way in back. We'll look at the tonsils, make sure there's no redness there. So, and Dr. Thompson is next.
Thank you. Yes, thank you, Dr. Laspina. So I'll talk about oral health conditions in older adults, and we're going to cover 4 main topics: xerostomia or dry mouth, stomatitis or inflammation from the denture or partial, and then edentialism, or that's total tooth loss, and tooth wear. So dry mouth, this is a common side effect of most medications that are prescribed or over the counter. And it can be a mixture of medications. It could be the sum total of all of the medications that you're taking. But it can really be felt in the mouth. And you can also kind of see it as this dry appearance. There's less saliva in your mouth. There might be no salivary function, or it's just very slowed. And this may change during the time of day as well. And so with this dry mouth, it puts your mouth at a higher risk for getting cavities. There are common over-the-counter medications or supplements that you can take to improve the dry mouth. This can be saliva substitutes that you'd have to get a prescription from your physician or your dentist. But then there's over-the-counter rinses that you can use, lozenges for the mouth, xylitol products, which can actually kind of prevent from getting cavities as well. There's alcohol-free mouthwashes, oral sprays, or again, prescription medications. A lot of these things that you can buy over the counter really are just very temporary. They're not often things that I recommend because they might cost a lot of money, but they're not really providing a lot of benefit. It's more something that you need to learn to manage and work with. So that's also just sipping on water or drinking water throughout the day, making sure that you're brushing and cleaning your teeth out after you eat as well to really remove that food and bacteria that's sticking to the teeth. So here are some of those products that you can get over the counter. I think some of the ones on the left side, the Xylamints or dry mouth mints, those actually have xylitol in them, so they can help prevent dental decay, whereas some of the Biotene rinses are just trying to provide moisture to your mouth. So there's some products as well all day. Some of these things you can get in the store, and some you might have to just order online. So just be very careful with online ordering and avoiding any scams. Have somebody help if you're just not sure. So what are some other ways to manage? Again, talk to your physician. If there's new medications that you've started or the combination of medications is really drying out your mouth, talk to your physician to see if there can be a change in your medications. Again, drink more water and brush and floss more frequently. So stomatitis or inflammation of the mucous membranes of the mouth. So this might look like the picture. It might not be that obvious, but it's really an inflammation of that tissue, typically under a denture or a partial. And this is usually caused from really not taking the denture out frequently, leaving it out of the mouth at nighttime, or cleaning it properly. So it is a fungal infection or a candida infection that's growing because of that bacteria, because of the food, debris that's stuck to the denture and not getting cleaned. So it's really important to remove your dentures every day, brush them with a toothbrush or a denture brush and water, and then soak them or leave them out of the mouth for several hours or overnight if you can. I often tell somebody it's often like if you just stick your hand, in a sink, or if you're in the bathtub and you soak your body, it starts to get wrinkly, the tissue starts to break down, and now it's more susceptible to getting infected. And so again, keeping that denture or partial in the mouth is not allowing the tissue to kind of dry out, and so it's always moist, and it's more susceptible to infection. You can also, other types of stomatitis besides candida is also herpes stomatitis or a cold sore, or aphthous stomatitis or a canker sore. So edentulosum, this is the complete loss of all of your teeth, and the bony ridges on the top, the maxilla, and on the bottom, the mandible, support the teeth or other replacement options. And when we don't have any teeth, that bone starts to recede or be lost. And so you might have a very thin or flat ridge that makes it also very difficult to fit dentures to. Dentures that are ill-fitting can be because you've lost weight. It could be because you have more bone loss, and then the solution for that, might be different options, including implants or removable appliances that just need to be relined or remade, or just secured with denture adhesive as best as possible. So what are dentures? There's some examples here up on the screen. On the left are full set of dentures, and in the middle there are partial dentures. There are a few different types of partial dentures. They can be all acrylic or all plastic, or they can have a metal framework like the one on the right side with either metal clasps, or they could be all acrylic clasps. And really discussing this with your dentist or dental professionals is important to find out what's right for your mouth and what the best fit is based on the position of the teeth and the amount of bone you have, as well as dexterity and how well you're able to remove those dentures from your mouth. So what is proper care for the dentures? I mentioned this a little bit before, but it's really important daily to clean your dentures, to take them out of the mouth and brush them with a toothbrush or a denture brush, and a denture-specific cleanser. So you can get tablets at CVS, Walgreens, any store, to put into the water to help clean them as well. Again, I've mentioned some of this, but removing them at night to rest the gums as well as the oral tissues, to soak them overnight, and avoid using things like bleach or abrasive toothpaste that can really abrade the denture surface and make it more susceptible to getting food or bacteria stuck to it. If you do use a bleach solution, you want to make sure it's very diluted and that you're rinsing it and cleaning it afterwards as well, and not using it for more than 15 minutes. So you need to watch for signs of irritation or sores or bad odor. These can indicate other fungal infections or other oral disease, or as previously mentioned, periodontitis as well. So dentures that are fitting well and are kept clean well do not damage the teeth, but if you're not properly taking care of that partial, and plaque is building up on the teeth, and it's making them susceptible to gingivitis and then periodontitis. You could lose teeth because of that as well. So proper oral hygiene is really important. And then, as mentioned before, some of the tips: dentures may need relining, they might need rebasing. Those are two different types of reline of a denture. It could be a hard denture material or a more soft denture material. And this is really something that needs to be done based on individual case, as well as dentures being remade. I know Mass Health, I believe, covers dentures every 7 years. Some people I've seen have dentures for 20 plus years and they're in great condition. They're kept well, and that's okay. But based on the wear and tear of your mouth, you may need to have them replaced more frequently. So I'm going to pass this back to Dr. Goon. Oh. Dr. Laspina.
Okay, tooth wear. Thank you, Dr. Thompson. That was awesome. Thank you. So tooth wear. This can happen various ways. One of the ways is if you're grinding or clenching your teeth. You're going to exhibit or show some, it's referred to as attrition. And you can see in the top right-hand corner, right, how the teeth are worn. There's another way also that you can, and it's just really attrition again, brushing real hard. You can see that on the bottom screen, brushing very, very hard. Now, some of us remember when we were younger, really little, like 6 and 7, and we went to the dentist, they told us to use a hard bristle toothbrush, okay, because you need to really clean your mouth. That's not the case. Research has now shown that when we do use a hard bristle toothbrush, that you're really wearing away the teeth, that you need plaque, and they call it biofilm. See, research changes things, names, but that's okay. It's the same principle. Plaque or biofilm is very, very soft, so you don't need something hard to remove it. So you always, when you're purchasing a toothbrush, please always look at the packaging that it says soft, okay? And make sure. People will say to me, well, they still sell a hard bristle toothbrush. Oh, yes, they do, and I still purchase them. You know why I purchase them? To clean my tile. I said the grout. I said that's why. I said I'll purchase a hard bristle toothbrush. So please, you want to make sure to use. Tooth wear, yes, it happens with aging too. The wearing of our teeth. It does happen with aging. So, common dental procedures and concerns. Important to get your teeth in a dental examination by a dentist and to have your teeth cleaned every 6 months. As Dr. Gunda mentioned, it's important for our whole body to have our teeth cleaned. Get rid of that bacteria that's in your mouth. All right. You also want to make sure if you need a filling or a crown to have the proper work done. You want to restore and protect your teeth because you want them for the rest of your life. Our older adults are keeping their natural teeth, not dentures. They're keeping their natural teeth, research is showing. Sometimes people will have a bridge or they'll have implants. All depends the decision that is best for you, and your dentist helps you make those decisions. Some people will have extractions and then fluoride treatments. This all happens, you'll notice during an exam, right? That's what the dentist will look and diagnose. Do a treatment plan if someone needs a filling, if they need crown, bridges, implants, and then fluoride. Right, fluoride. Worcester is not fluoridated. So you want to make sure to check your fluoride source. What is your fluoride source? Well, we know it comes from your toothpaste. It can come from mouth rinses. Sometimes we have a high cavities rate. Some people, they're just prone to getting cavities, right? Sometimes, depending genetics, sometimes depending frequent snacking, a lot plays a role. And sometimes a person needs prescription fluoride toothpaste to use, which is stronger than what we can get over the counter. But please know that fluoride is needed on your teeth. I do make sure that I do have a fluoride treatment. A lot of people will say to me, I'm not a child. I don't need fluoride varnish or fluoride treatment. Yes, Now, the common oral disease for children is dental decay. Well, now guess who's catching up? Our older adults are catching up, and it's referred to as root caries. You're getting cavities on your roots of your teeth because some of us have recession, like that picture that I had showed where the gum recedes and goes down. Well, it's softer than our enamel, that tooth tissue there, and we can get cavities on our roots. So fluoride helps protect those areas. So definitely, please, and as I mentioned, Worcester is not fluoridated, so we have to find our sources. And the bottled water is not fluoridated unless it specifically says fluoride in the bottled water that you're buying. So prevention method, improve your oral hygiene. And we have pictures of the electric toothbrushes here. You want to make sure to brush at least twice a day, morning and at night. And you want to make sure to at least floss once a day. Some people will tell me, well, I can't floss, and that's perfectly fine because there's so much else out there that you can use. As long as we get in between the teeth to remove that plaque, that biofilm that causes disease. So, and a lot of people say, well, should I use an electric toothbrush? Should I use a manual toothbrush? Either one is fine. Yes, research is going to show us the electric toothbrush is better. It can get deeper. But I've been a clinical dental hygienist for 34 years, and my patients did perfectly fine with a manual toothbrush, provided that you do it correctly. And even with an electric toothbrush, you have to do it correctly. So always ask your hygienist, what's the latest toothbrushing method out there? Because research is always changing and showing us better ways to make sure that we properly clean our mouth. And even for flossing, there's so much out there now. You know, there's the water pick that you can use if you can't floss. There's the floss sticks that you can use. There's proxy brushes, they call them. There's so much out to get in between your teeth. So please ask your dental professional, what is the best interdental aid for me to use for my teeth? This is what we were just mentioning, and these are pictures of them. The top one is a water flosser. Research is showing how well that is doing when patients use water flossers, keeping their mouth healthy. They call them floss picks, floss sticks, some people will call them. And then we have our interdental brushes. So like I mentioned, there's so much. There's Stimudents. That's that wooden stick there, right? It's a dental toothpick. It's a little bit safer to use than a toothpick because of the way it's designed, so we don't injure the gum tissue. That's why that's a dental Stimudent, they call it, which you can still find at CVS or Walgreens, wherever you go, because I know some items are hard to find now. You have to buy everything online. So, like me, I love to go to the store. I miss my Bed Bath & Beyond. So anyway, so you can see all the different items there to help us make sure that we can get in between our teeth. So nutrition and oral health go hand in hand, most definitely. I like this little motto here, sip all day, get decay. I never heard that one before. That's cute, sip all day. And it's so true. You know, sometimes we love our coffee or our tea, and we're sipping it all day. And they'll say to me, well, I don't put sugar in it, or, you know, I don't put milk in it, I drink it black. You are still, the acids in your mouth are still going to be created from that coffee in an environment that can cause dental decay. So please, I tell people, yes, I know you love your coffee, but drink it in the morning for breakfast all at once. You want to do it at mealtime. Some people love our soda. Perfectly fine. I love soda too. I love chocolate. But I'm going to have it at one time and rinse your mouth with water afterwards. Like I mentioned, I've been a hygienist for a while, and in the beginning of my practice, I used to tell patients, oh yeah, little children, oh, you know, their parents were upset they'd been eating chocolate, candy. I'm like, everyone loves chocolate. I eat chocolate. And I would tell them, brush your teeth right afterwards. Oh no, that's wrong now. Research has shown that's wrong. Because, and I said, this makes sense. I'm going to take my toothbrush, and guess what? Those bristles are going to push that chocolate right into my enamel. Oh, I never thought of it that way. So please, you just want to rinse now, okay? And we need to wait a little bit before we brush those teeth. or you can rinse and then brush. But yeah, take that chocolate off. Don't have it staying on your teeth. So what about other foods that lower the oral pH to help prevent dental decay? And they're listed here. There's meat, fish, nuts, milk, cheese, vegetables, and sugar-free sweets. So here's our checklist for maintaining good oral health. Chew sugarless candy or chewing gum that's containing, Dr. Thompson mentioned xylitol. Yep, it's awesome. And you can find those in various places. The stores have them. You know, CVS sells them, Whole Foods sells them, any of the stores, Walgreens. Just you really got to look at the active ingredient on back of it. So you want to be very careful, especially, you know, we have that dry mouth. What is the best? Water. You know, drinking water, constantly saturating your teeth with water. Don't have that ginger ale on that nightstand when you wake up. You want to have water and sip that water. Also, always make sure to make an appointment with your dentist. Keep regular appointments, whether you're on a 3-month, 4-month, 6-month recare appointment. Brush your teeth every day using a fluoride toothpaste. Make sure that active ingredient, you see it says fluoride, to prevent decay and protect your tooth. You can use an electric toothbrush or a manual toothbrush. Okay? And make sure to use it. They refer to it as an interdental aid, whichever suits your mouth, the way your teeth come together. Some people have very tight teeth, right? They'll tell me it's so close, and other people have large spaces. So you want to ask your dental professional, what is your routine that you should be doing and using? And we had mentioned this, especially in Worcester, because it's not fluoridated. So you want a prescription strength fluoride, either a mouth rinse, you can do toothpaste, and then I have a fluoride varnish treatment every 6 months to protect my teeth. And there's another rinse, chlorhexidine, if we have gum disease, that helps reduce that, helps the gingivitis, helps periodontitis, helps any redness. But that's something, once again, it's a treatment plan that your dental professional will prescribe for you. You want to have your teeth cleaned by a dental hygienist at least twice a year. Like I mentioned, sometimes people need it more often. And the fourth one that you see there refers to your medical history. Important to make sure to be very detailed in your medical history so that the dentist can make the proper diagnosis, especially because sometimes you do need to be pre-medicated before any dental treatment. So please, as Dr. Gunda mentioned, you want to call your dentist if you're experiencing bad breath, pain upon chewing, if you feel that your teeth are loose or they're shifting, if your gums feel swollen. That happened to my mother one time. She was flossing. The floss got stuck in between her teeth. Then she grabbed a toothpick, non-stimulant, a toothpick. She got that stuck in between. So her gum tissue was swollen. So she had to see her dental professional, who took care of it for her. So make sure there's no sores or patches that don't heal. 2 weeks, 14 days. If you see a red lesion, a white lesion, doesn't go away, you want to call your dental professional. And if dentures no longer fit, please call. These are the systems, right? The coverage for medical dental coverage for adults in Massachusetts called Mass Health Medicaid. It is for people who are older than age 65 and above and disabled, or perhaps those in a long-term facility. Various dental procedures are covered. We're very lucky in Massachusetts that we do have dental benefits with Medicaid. So, and this is always changing, but once again, your dental professional can help you. And please don't hesitate to have Mass Health Medicaid if you need it for your dental coverage. There are areas that will accept Mass Health as Massachusetts League of Community Health Centers, and we're very fortunate that there are about 300 sites in Massachusetts. So please find, a site that can help you with dental. Here's one here called Edward M. Kennedy Community Health Center, and then the Family Health Center of Worcester is another option. And of course the schools, don't forget about the schools. We have Forsyth School of Dental Hygiene in Worcester, campus, not too far from here, 2 miles actually, 2.1, because we came from there, and Forsyth in Boston, and then also you have Quinsigamon Community College right here in Worcester, and for restorative care. So those are strictly dental hygiene schools where they can clean your teeth, they can take radiographs. There is a dentist on the clinic floor who can do an exam. And then all that information can be sent to one of the dental schools. Harvard, Tufts, BU. We're very fortunate to have as many dental schools where they can take care of the restorative, such as if you need a new denture or if you need a filling crown. And they also do implants too. So very fortunate. And now you have a train, right, that goes right to Boston, which is nice. So thank you for your attention. Our key giveaways is oral health is vital to overall health. Preventive, proper preventive oral hygiene is going to reduce the risk of oral diseases and bacteria transmission through your body. Please contact any insurance providers or local community health centers and inquire about dental services. Most important, you want to find a dental home where you feel comfortable to take care of your dental needs. And don't ever be afraid to ask questions, and ask where is a resource. So we want to, any questions at all about any of our topics? The floor is yours. Yes, we have one way, way back.
Hi. I just want to know a little bit about the implant things. I was told that oh, good. You went through the gingivitis and the periodontal disease and the bone loss. If you have extreme bone loss, are you still a candidate for having implants?
That's a good question, and I can't say right now, but you'd need to go to the dentist. They have to take images, radiographs, but also a scan of your mouth and of the bone to find out if it's enough bone, the quality of the bone, whether they'd be able to, add any bone, or what needs to be done. So that is definitely something that you'd need to go into an office to find out.
Okay, thank you.
You're welcome. Right here in the front.
Hello, I just wanted to ask a question. I have a dentist that I really love and trust. He did an x-ray, the kind that goes around, and he told me that I have 2 teeth that need root canals because they're infected, but yet they're not bothering me with any pain, and I'm wondering if I really do need to have these done.
Great. I mean, I can't say without seeing your mouth as well. If you've been with this dentist for some period of time, I would trust them that this might be something new that they've seen versus something that's chronic and hasn't been there. But yeah, I would again discuss with them, even saying what your hesitations are, just so that you can get all that information.
Yeah, sometimes something else too that just made me think of when I saw patients and we would take x-rays and we'd see a cavity. And the patient would say to me, but I don't feel anything. Please know that's an infection, that's like a disease that's in that tooth. It doesn't go away, it grows and grows and grows to eventually it gets so big that you do feel it. But what happens is more of the tooth tissue's gone. See, when the dentist sees it radiographically, they want to take care of it because it's tiny. So, important to, it's so great. You want to trust your dental professional that that person is providing you the treatment plan that is needed. Because unfortunately, that is one thing with dental is a lot of times we don't feel it. But then by the time we feel it, it's larger. So, yes.
Yeah, that also, helped me think about something we didn't mention too that is a sign as we age the pulp or the nerve chamber inside the tooth, it starts to shrink. And so we don't feel pain the same that we did when we were younger. And so a lot of times that masks what really is going on in the mouth as well. As well as the pulp chamber, which is the inside of the tooth where the nerve and the blood supply are, that shrinks, while at the same time, the layer inside the tooth below the enamel, that starts to thicken as well. And so these are kind of protective factors that stop us from feeling pain, but there still might be something going on underneath. So pain is not always the symptom that we need to go to the dentist. Routine, regular checkups are really important.
I just want to say thank you for all the information you've shared with us today and for the slides that we can read. The print was great. And just from my own experience growing up in a generation which did not necessarily have good dental, my first experience at the dentist were awful. And then I found a wonderful dentist here in Worcester and have continued. And there's a young man now, I asked him, how did you decide to become a dentist? Nobody wants to go to the dentist. And he just said, oh, I was a neuroscientist, but then I decided to change professions. So I just want to thank you for all the good information you've given us here today, because as we age, I think it's really hard. I do not have good teeth, and I really need my dentist and my dental hygienist. Thank you very much.
Thank you.
My dentist has never offered me fluoride treatments after I've had my teeth cleaned, because I do that regularly, and I have had fluoride treatments in the past, which I'm not opposed to, but I've never recently been asked, do I want a fluoride treatment? Why?
That's something that you can just say, I'd like one. No. Oh, yeah, you certainly can. Because I think most of the time it's given to children, but you certainly can ask. Say, I would like a fluoride treatment. Not at all. Right. Perhaps, yes, you're right.
I was just going to add, too, that it might not be a covered service as far as preventative care, like a cleaning, or so it might not be something that they're offering for that reason. But again, because of all of the common oral health problems, particularly dry mouth and the gums receding or moving down, you're at a higher risk. So it is really good. But you might have to ask.
Could you please talk about mini implants versus regular implants?
Yeah, I don't place implants, and so I really can't, speak to that. I'm sorry. Okay. Yeah, I don't think anybody here. Okay.
When you go to CVS, the aisle is loaded with so many different toothpastes, and I'm always looking. Sometimes I just buy whatever's on sale, but I just wondered if there was one that you would really recommend.
Yep. I understand that question. I say when we go down the aisle, it's like a rainbow. It's so pretty. All the different mouth rinses and everything, I love it. So it's the active ingredient, and it doesn't matter what brand it is, because one brand basically is not better than the other. The first thing you want to look at is active ingredient fluoride. Okay. Sometimes people have sensitive teeth for various different reasons, and the Sensodyne is a brand. But there are other brands too that have the active ingredient potassium nitrate that helps desensitize areas. Please know fluoride does too, but potassium nitrate helps that.
Yeah.
Then you'll see other toothpaste that will hone in on gingivitis, and that's okay. I mean, those are fine. But I flip it around and I'll say, well, does it have that fluoride that I want? Or the xylitol. Some people want xylitol too. Does it have the xylitol? That's going to help me with my cavities.
The other thing is, I have some crowns, and I always thought, I used to say I had more than Queen Elizabeth, but every so often, I have had to have a crown replaced, and I just wondered if it's probably because the gums recede and they don't feel as tight anymore or whatever, but I thought I would live and die with the ones I had initially, but I guess that isn't the case.
That's a great question. So a crown covers kind of all surfaces of the tooth, kind of like a hat or a cap. We also call them caps. And the margin or the edge of the crown is on tooth structure. So you can still get a cavity at the edge where the crown and the tooth meet. So proper oral hygiene is really important to maintain those crowns. They could last you a lifetime, or they might get decay at that edge of the crown and the tooth. And then again, depending on where that edge or that margin is, if the gums do recede and now you have more tooth structure exposed, that's also susceptible to a cavity. So you're welcome.
And you're going to stay.
Question, you're more than welcome to ask us because we're going to stay a little bit. So thank you so much for listening. We really appreciate your time.